something deeply troubling just happened in Grand Traverse County, and most people still don't understand the full impact. A clinic that delivered millions of dollars in free dental care to veterans, children with disabilities, and people turned away everywhere else suddenly shut its doors. Treatments were left unfinished, patients were left stranded, and serious questions remain unanswered. Today, on Traverse Talks, we bring you an exclusive interview with the former director of United We Smile, Jennifer Kearns, to explain what happened and why this should alarm every member of our community.
Well, Jennifer, welcome to the program. It's good to have you on. I saw you today at the Grand Traverse County, the board meeting, and I must tell you, it was rather upsetting as to the services that United We Smile are no longer going to be here in Grand Traverse County. I did see, and maybe some others saw, a real small clip in the newspaper, but it really didn't go into any detail. So I'm glad you came on the show and let's talk about it. So for those that don't know what United We Smile did, I think it's important if Jennifer brings you up to date on that, because that's important, because that's not going to exist any longer. So Jen, go ahead. Tell us what United We Smile did, and then we'll go into some of the other questions.
Okay, sure. Thank you. So I started the clinic back in 2022. I actually left public health dentistry, and I'd been driving around in a dental van providing services to, shelters and baby pantries, and I had 20-some elementary schools, and I'd park out front of Safe Harbor and provide all the preventive dentistry that I could. But it was really challenging because a lot of people wouldn't take my patients for definitive care afterwards, and that was including the public health center that I worked at. So I was struggling finding people to see my patients who had really challenging comorbidities, weren't high functioning in society, whether they had schizophrenia and bipolar and ODD and OCD, and just a gambit of behavioral health issues that prevent them from just easily picking up the phone, scheduling an appointment, and keeping that appointment. Also, veterans have some severe PTSD and other issues and don't get dental care. They don't have a dental benefit unless they have 100% disability declaration. And pregnant women are a priority. They really need to get out of decay before they give birth, and that is for the safety of the delivery of the child as well as the future of that child. And then also we have pre-cooperative children. So kids that, whether they're neurotypical or neurodiverse, a lot of kids have behavior issues, and it can be kind of scary going to the dentist. So there's long wait lists to get into pediatric dentistry, where you can get specialized care for behavior guidance and comfort and sensory issues and things like that. So I decided to build this clinic to kind of fill the gap, and the access to care issue with people, these types of people specifically not being able to access a dentist, was the goal. And so how do we change that? We teach the dental students how to do this work so that no longer in the future, dentists can turn away patients because they lack the training. So we worked with the students to teach them how to treat patients with challenging comorbidities, things that a lot of dentists shy away from. If, they need a medical consult, they have HIV, they have a behavior issue, they have a large mobility device, they have severe PTSD.
These are dental students, right? Dental students from the University of Michigan, is that correct?
Yes. Yep. Okay. So we had up to 16 students a day, and we would teach them how to work with patients to accomplish dentistry. So, the students would come to us, know full well how to do a filling and extract a tooth and things like that. But it was this specific population of people that dentists typically turn away from because they aren't trained in behavior guidance. They're not trained in, can take the time and really challenging comorbidities and navigate a lot of that stuff or deal with sensory issues. A lot of offices aren't set up that way. So we would teach the students how to accomplish that chair side with their delivery of care, as well as how to outfit their future office with just minor cosmetic things that can make the life so much easier for a patient. So we were improving access to care long term by training dental students and meeting their graduation requirement. So when the dental students have to graduate dental school, there's an organization called CODA, and it's the accreditation for dental schools that they get to graduate students that can sit for the board exam. So a school has to have CODA accreditation in order to graduate a student to sit for the dental board exam. And so a lot of those requirements are hard to meet for a dental school. So we were a satellite for University of Michigan CODA to teach the students specific behavior guidance and these challenging comorbidities. And that also is to improve access to care. So CODA has these goals to improve access to care by helping the dental schools try and meet this requirement. When I listen to you, number one, the service that United We Smile took patients that were disabled, had functional issues, mental issues, and so forth, to take care of those people. And in addition, you guys use the University of Michigan dental students, obviously a lot less labor cost, right? I mean, exactly.
And you used about 16 or so of these a day to work on these patients, and then obviously, train them how to handle it. And in addition, they also receive their CODA. Is that correct? In other words,
Yep.
Their CODA certification or whatever they call it. So United Smile, wow. I mean, you stop to think about this. You guys provided services for disadvantaged people and people with real problems and vets. You provided the dental students, and then they got the training and so forth that they would need going forward. Holy bajoli.
That's correct. So I designed the clinic specifically to try and solve the access to care issue because it's a huge issue and it's very complicated. And after working in public health for decades, I saw all the issues, all the barriers, all the government regulations when you take money and become an FQHC or, you accept this contractual relationship, you have certain requirements you have to meet in order to get that funding. So like you can't do same day service, you can't do same day x-rays. There's certain little nuances you have to try and work around. There's wait lists to get into the clinic. People can't get out of decay. It's just a bottleneck of red tape. And so this clinic, the way I designed it, it removes all the red tape, and we're teaching the students, the community gets dental care, and it's a win-win for everybody. I started the clinic, but I did not do it alone. This is a community effort. We had partnerships with organizations far and wide across the state. We got reduced lab fees for building crowns and dentures. We got a significant discount by partnering with this lab downstate. We have a grant that pays all of the lab fees for the veterans to get teeth. So every single veteran would get free crowns, dentures, all of that stuff donated by Delta Dental. We had endodontists that would donate a root canal for veterans. We had a couple offices doing that graciously. We had extractions donated. The VA was giving us $12,000 a month because their return on investment was at least fourfold for that dollar. So the VA would pay us $12,000 a month, and I could produce up to $42,000 a day for 4 Fridays. So one Friday, $42,000. The next Friday, maybe $32,000. The next Friday, maybe $38,000. And I provided all of that for the veterans for just $12,000 a month. And then University of Michigan
I was
was
going to ask
paying
you on the total, and you recited a number there, the total free dental care to benefits to the veterans. How much did you say that was? Approximately.
It was $1,246,298, and that is in 2 years and 3 months. So about 82 Fridays.
And what
So
about the
82
other?
days. We did almost $1.3 million just for veterans.
And what about the other dental care? That was a pretty significant number too for people who were disadvantaged or on the poverty program.
Yep.
What was that number approximately?
So including the veterans, our total was $3,766,183, and that's just over 2 years of being open. So
That's all gone.
yeah, so I mean, no one's going to get that anymore. So it's, I mean, unless we have a solution, and we're not giving up, but it's, I mean, it's a significant loss because we're not taking patients from other dental offices or public health. These are patients who literally do not have a dentist because they go to this office and they say, "Oh, I'm sorry, your child is too young." They go to another office. "Oh, I'm sorry, your child is too young." They go to another office. "Oh, your child won't sit still in the chair and they're crying." So they bounce around and use their insurance up, take time off work, and try and drive all over tarnation trying to get their child help. They come to us and we can do almost all of their treatment in one day, in and out, get it done. And we teach the students to do that. We have veterans who've been on the list for over a year to get help because they don't get a dental benefit because they're not 100% disabled. That's ridiculous. So, the veterans, they get 12 months in the program because oftentimes the treatment is so extensive. So they would start in May and we would finish them in April and do every single thing that they needed. So I think our most expensive veteran, his treatment plan was about $40,000. And, that's not normal. We wouldn't do that on every single veteran, obviously, but this person could not function. They could not chew correctly. They could not, their quality of life, I mean, they needed full reconstruction. There's no way that person would be able to get that. And so that veteran is unemployed, home isolated, not going out into society, and thinks no one cares about him. I'm getting emotional. Sorry.
Well, I was going to. How many patients did United We Smile have typically? I mean, total.
A few thousand. So we served. I think the last I saw, we had about 2,300 patients, maybe.
Oh.
And so, if you look at like the numbers of who we were seeing, we had about, I would say 25% of our patients would be considered what they call special needs. We say they have personalized healthcare needs. But a lot of people would say that they're special needs. So they're neurodiverse. They have neurodevelopmental disabilities, mobility disabilities, things like that, where they just can't access care in a typical private office. So that was about 25% of our population. So that is very specialized care. If we don't do that work, they have to get on a wait list for either Henry Ford down in Detroit or this long wait list in Ann Arbor at the university in their special care clinic, or they have to pay out of pocket and get sedated. But, they changed rules for pediatric dentists. So it's a little iffy about if a pediatric dentist can see adults. And that is a mistake as well. So
Mike Leahy from the health department, who was on at the tail end of the meeting, said there really isn't anybody.
No, there's not.
In Traverse City that can fill this gap. No one.
No.
It's because it's such a special niche. So let me get into a little bit of what happened.
Okay.
What it sort of happened suddenly. I mean, at least to I saw it in the paper, and then, obviously I listened to it this morning. So what happened? I mean, how did this thing all go south?
That's a really good question because, we speculate little bits and pieces are coming out and we're putting two and two together. And we kind of think that they had this planned for a very long time. We don't think that this was sudden for them. But I was first informed about it when the United Way executive director was getting ready to resign. And he warned me of some things that were happening that he had discovered. And he wasn't comfortable sticking around, and it was really taking a toll on him personally. So he chose to leave. And, that was really hard for him. And so when he left, I took what he said to heart and I started investigating because, I'm in patient care all day long. So doctor and I, we oversee all those students. I'm a preceptor, doctor's a preceptor. I'm trained in behavior, doctor is not. So, we had a very small team overseeing all these dental students and providing all this work. That's why we had such low overhead cost and it was super efficient. So I did not manage QuickBooks. I approved all of the receipts, all of the expenses. I would sign off on them and send them to the bookkeeper. This is okay to pay. This is okay to pay. I had a budget that I created when I started the clinic. I stuck to my budget. I was actually under budget every single month. So that was, let's see, the executive director left in May. That was his last day. It was in I think it was the beginning of May. And then, we as a team, as a dental team, started asking United Way if we could see the QuickBooks and access the documents and the bank account and see what our bank statements were showing, see what the issue was. And they said, oh yeah, we're going to have full transparency, and the board took over and all this stuff. And we weren't told anything. We asked and sent emails and demanded meetings, and it was not a collaboration. It was lots of secrets and ghosting us and not answering questions, and I knew. So when I started the clinic, one of the financial barriers for me starting the clinic was I knew I had to get out from that lease. The lease in that space, it's a 15,000 square foot building. And I took about 7,000 of it I renovated, the building, and then I the clinic was housed in about almost 7,000 square feet of it. So I was taking up about half of that facility. And I knew when I started the clinic that I had to purchase the building to get out from the mortgage, or the lease is $21,000 a month with the association dues $4,000 a month. So that was another thing. I found out that even though I was only in half the building, I was paying the majority of that lease, unaware of that. So they were taking more money out of my bank account to pay more than what, I thought I was paying. So lots of things have come out. But when the executive director left, I got on the ball to try and work on buying the building because he was working on it. And when he left, it became stagnant. So I had some legislators come and we passed the appropriations to get the $2.9 million allocated to our clinics because all the testimony to get that to happen. When I drew up all the testimony, it's all of the data of what we did with the clinic. It was purely for the clinic. Had nothing to do with United Way. United Way is the fiduciary that would manage my books and payroll. So it was United We Smiles bank account with United Way having their own bank account, but they were running our books and our payroll for me. No oversight over patient care, no oversight over clinic operations. Obviously, they have no idea how to run a dental clinic, so that's really not a surprise. It was a give and take relationship. They were getting donations from all the good work we were doing. There's a lot of publicity. That's fine. That was part of our arrangement, is we would do all of this great work. They would publicize all of our great work, get more donations coming in, and grow United Way. And that's fine, because we don't need to take credit for all the good work. All our patients know all the good work we're doing. So, and we're helping people, and that's really all that matters. So we don't care about the publicity or anything. They can have that. So when the legislators came and we passed appropriations, all the testimony for that had to do with the clinic. The clinic has to stay. We're saving the taxpayers from emergency room visits for dental reasons. We're saving with Medicaid, Healthy Kids, all of this stuff, all of the sedations. When you put a child to sleep, that's thousands of dollars at the hospital. And we could do it in office, in a visit, without having to do that and risk the child's safety. So, and plus the VA, I mean, the return on investment for the VA was huge. You cannot do that any other way.
So Jen, what happens now to the $2.9 million? Where's that at?
Well, that's what we're trying to find out. So it's allocated for the clinic to be able to buy the building and not pay the lease. So the clinic would be sustainable without the lease over its head. And, that was the last thing that we needed, and we got that. So the building purchase is 2.47, and the allocation from the state is 2.9. So, there's plenty of money left over after that. I mean, there's some repairs that have to happen to the building a little bit here and there, but nothing that I know of massive. I did a renovation. So they did it.
Where are you guys gonna go now? I mean, what's the clinic is shut down for now. You got the $2.9 million someplace, hopefully.
Well, whoever does United We Smile and keeps United We Smile going gets the $2.9 million, because
United We Smile, is it possible to come back? Is that what you're saying, or?
We would really like to. I mean, they let all of us go and close the clinic, and they need more money. And, I did not start this clinic to support financially United Way. That was not the purpose of the clinic. It's not to become profitable and line the pockets of, whatever they want to do at United Way. They were here before me, and they're here after me. So the clinic really, it's good work, and I chose United Way to partner with because I appreciate their mission statement, and the executive director and I had a really good working relationship. And, they were doing the right thing. But when he left and the board took over, I don't understand how their bookkeeper still has her job. I really don't. So I just want to say, I don't know if everyone knows this, but, the dental team, there was 6 of us, a very small group, and it was the team that held this together. So without the team, we were so dedicated in this mission of teaching future dentists and providing this care for the community that really needed it, that when United Way took more of our money, they fired one of our employees because they needed to make payroll. That was devastating to break up our team. Then they gave us pay cuts. No one on United Way got pay cuts, but they took money from the dental team. We are self-sustaining. Why should we give up part of our pay? We work so hard and so many hours doing this work. Then we lost our cleaning company. So I was cleaning the toilets at the end of the day. Laura was mopping the floors. We all chipped in to do the CHW job, to clean the clinic, to take the pay cuts, because we knew the $2.9 million was coming January 1st, and we would make it through and, hopefully get a new, I've requested a third-party accountant to do our books separately and take our bank account back away. And
Well,
It's a battle. I mean, there's a lot I want to tell you, but I'm being very
what I
careful.
would do is just refrain and tell a lawyer or an accountant. I think that's what you probably need to do. Anyway,
Yeah.
Jennifer, it's really been great to have you on the show and talk about this. It's extremely important, folks. You can't kiss off $3.7 million in a community, underserved people and so forth. It's not good. Jennifer, let us know when you guys start up again, because I'm sure that's going to happen.
Thank you.
you.